Hi, everyone. Thank you for listening to this recording today. We wanted to take some time and walk you through the 2021 October Atlas survey that we're asking that providers in the Atlas states complete. We wanted to give you a high-level overview, talk through some of the resources included in here, and get your minds to start to think about what information might be useful as you go through the survey and complete it. I'll quickly remind you all that we sent out a reference copy of the survey last week. So if you want to take a look at the survey questions on your own time, feel free to take a look at the reference copy, or if you haven't received it, feel free to reach out at atlas@shatterproof.org to take a look and to let us know so that we can send it to you. So this is the landing page for the October 2021 survey. This is what you'll see when you ultimately receive an email to the primary contact at your facility with your facility specific link. When people go to complete the survey, each facility has its own specific link. So when taking the survey, you want to be very careful to make sure that you're using a link that is specific to a facility, and by facility we mean single site of care, has its own unique physical address. Once you click the link, again, you'll be taken to this landing page. You'll have very high-level instructions here. Feel free to read through in your own time. And what you'll also notice is there's some helpful links at the top of the page. So if you want to look at the reference copy of the surveys you're taking it, you can select this 2021 survey link up at the top. If you want to peruse the FAQ while you're taking the survey, you can click the FAQ link at the top. And of course, if you're completing the survey and you think, I really have a question that I need answered before I can continue onward through the survey, you can click that Atlas Help Desk link at the top as well. And these appear on all of the survey pages so that you can use them as needed as you're going through and completing the survey. I'm going to go to the next page because there's a lot of helpful information. As you all probably know, the survey is going to be released on October 28th, 2021. So very close. And what we want to note with that is you'll receive an email from Atlas with your unique survey link. It'll be one link if you're overseeing one facility. It will be multiple links if you oversee multiple sites. So again, it's an individual link for each site of care. And so you will receive reminder emails throughout the data collection process every so often with these links, just in case you need a reminder, in case you're in the process of completing, in case you need that link again. And the survey ends on January 28th, 2022 at 11:59 p.m. Central Time, if you want to be very specific. As you're completing the survey, you use those buttons that you saw at the bottom of the screen. You navigate through those back and next buttons. You can always go back, you can always go forward. So if you want to go and revisit a question you previously answered, totally fine, feel free to do that. If you want to continue to move forward through the survey, you'll hit next. What you may also notice is that as you're clicking the next button, as you're going back, your response is saved. So you can always leave the survey and return to the survey, and any progress that you have made will be saved within that online survey link. You have to use your facility specific link for your responses to be saved, so don't use any other links, but as long as you're using that facility specific link that Shatterproof saved to you, your responses will be saved. You can return to the survey at any point. What we want to also note to our previous states is that some of your responses may be pre-populated. This is specific to providers who have completed the survey before. If you're a new Atlas state, this doesn't apply to you at all. If you have previously completed the survey in 2020 for Atlas, you will have some of your questions already answered. And this is because we've pulled in your data from 2020. So what we encourage you to do as you're looking through these is, take a look at your questions, look at the responses that have been pre-populated, and make sure that those responses are still accurate. We've added some new response options to some questions, so you'll want to go through, read those questions, look at the new response options, and make sure your selections are accurate. What I also want to point out is we cannot pre-populate the other fields. So if you want to add other response options to pre-populated questions, you'll want to select that other response option and then add any other items that apply to you, whether it's other assessments, other types of services, to that text field so that we have that captured and we have it accurately reflected in your data. I'll quickly note that some questions are required, some aren't. You'll be able to see them with that little red asterisk you see right here. And as mentioned, we have a couple of helpful resources for you. One is linked here. You can always go look at treatmentatlas.org. You can search for your facility. You can look at your profile. Always good to have that linked there. We include here and always at the top of the page, link to the reference copy of the survey, just in case you want to look at that paper copy, in case you want to print it out, circle some of the responses so that you can go through and add those to the online survey once you get your link. Totally fine. What I will say is we can't accept paper copies of the survey. We have to accept online versions. But if you do want to ahead of time answer the questions, it's perfectly okay to print the survey, make your selections on paper, and then transfer them into your online survey. We also have a frequently asked questions section, as mentioned. You can click here, you can check it out. We have the help desk. And then another thing I want to quickly mention to you all is we have office hours. So if you want to get some time one-on-one with the Shatterproof staff person to answer your survey questions, you can sign up for office hours. The link is there. What we ask is you provide a little detail on the help that you need specific to the survey, and then we'll reach out to schedule some time to connect. So all of these options are available to you as you're completing the survey, and we want you to take full advantage of them so that we can support you in your submission process. What you'll know too is throughout the survey, and I'll show examples, there are tooltips. So these little dots underneath the word, that's a tooltip. We have words that we want to make sure are defined for you as you're completing the survey. So those, you'll see that little line. If you scroll over it, the tooltip, a little pop-up will appear that defines the word for you as you're completing a question. Another thing is we want to encourage you to take the survey in certain browsers. Internet Explorer doesn't work very well, so you may run into challenges if you elect to use Internet Explorer. As you complete the survey, there's an option to PDF towards the end. You'll see it. It's its own section, PDF the survey. We'll show that as we walk through. And you'll want to make sure that you have all of the appropriate staff people involved in this process. It can take multiple different people to answer these questions. We're fully aware of that. Take a look at the reference copy and start to think through who might need to be included to answer some of these questions. And if you have any questions ahead of time, please feel free to send them to us because we're happy to answer them. But we want to say that ahead of time. You may want to include other staff beyond the primary point of contact in completing the survey. So feel free to send the reference copy to them. Think about the ways in which you can collaborate to get this work done. And that will help in having these answers ready for the survey for submission. So we start with section A, which is your contact information. These are very straightforward questions. They're asking you to confirm your address. If it's not updated appropriately, if you need to make a change to your address, all you need to do is select no. And we'll have some fields for you that will allow you to update your address so that it's the most current address on file. We ask a few questions to confirm that your facility falls within the sampling frame. Do you offer substance use disorder treatment? Are you an addiction treatment facility? Are you currently open? Do you offer in-person treatment, since we're collecting surveys primarily from and only from in-person facilities at this time, facilities that are offering in-person care. And we also just want to make sure that that your facility doesn't only offer care to certain patients, particularly those individuals who are currently incarcerated. We ask for some contact information. I'm just going to input some test numbers, but you'll see above these different items, you have examples. So it gives you the format in which you want to submit certain items or information. So I will follow that format, type in that information, and include it there. An email, you just want to make sure anytime you ask for an email that you include it, that the email is in the correct format. It has that @ google.com or, any kind of thing that, at gmail.com, at gmail.com, so that it's in an appropriate email format and that we can catalog that. I will note that this information is not publicly shared. We don't share any contact information with external parties that's submitted through the Atlas Treatment Facility Survey, so no contact information that you provide here will be shared. So no worries about that. We want you to feel secure in sending that to us. Another field, just to get contact information, we ask for both the CEO as well as the person taking the survey. So I'm going to complete it by using the same formats. A new question that we're asking is, and we would love to get your responses for, is how best can patients contact your facility? We have a number of options here. If none of these apply, you can always select the other option and we'll allow you to import or add the other way that people can contact your facility. You'll see if you make selections here for email or phone, these options appear below for you to add, and you'll add the specific phone number or email that patients should use to contact your facility. We'll add a phone number for now, but this is information that we'll use on our site to allow patients to directly connect with your facility. So we're using a process that is most amenable for your site. You can add your organization's website. We'll add Shatterproof. And actually we'll, and then, is your organization owned or operated by a separate larger entity or parent organization? This is if you're in a situation where there are multiple sites across your state or otherwise that all are underneath the header of a larger organization. So if that's the case, you want to say yes. If you're an individual facility, you don't have that larger organization, you'll want to select no. So this takes us to the next page, which is just getting some facility details. You'll see we ask for your mission statement. That can be anything that you already have available. You'll want to make sure it's 500 characters. And we provide an example text here for you to think through what it would be a good mission statement to include in this response. I will note that mission statements are displayed in the facility profiles on the Atlas website, so you'll want to make sure that the text you place here you're good with, because it will be publicly displayed. The next question has you enter your payment options. You want to make selections that are relevant to the facility for which you're submitting these responses. They range anywhere from cash self-payment to Medicaid, Medicare, private health insurance, some state-financed options, military insurance, Indian Health Service insurance, and otherwise. You again have that other option if you want to. If you select it, you'll have that text box appear below so that you can include any other payment sources that are not listed already in this survey question. You'll see that I keep clicking next to continue through the survey as I complete questions. This takes us to the next question. We ask you to provide the approximate percentage of patients who are covered by the following payment sources. So we want an estimate. You'll want to make sure that these values that you enter here are equal to 100. So make sure as you're completing it that all of your different options equal 100.
And Shannon, just a quick question. I apologize for jumping in.
For sure.
When saving responses, do you need to hit next to save those responses that are on a page, or once you've entered any information on a page, it's automatically saved?
Good question, Carolyn. You need to hit next. If you don't hit next, your responses won't save. So always make sure that before closing your survey, you hit this next button to ensure that your response is saved. And I'll very quickly show you that as you go back. we'll go to the bottom of the page, apologies for the roller coaster, that those response options has saved because we hit that next button. Now what you'll see here is because we selected that we accept private health insurance, we have a listing of private health insurance options that are very specific to your state. So you'll want to go through, make some selections that your facility accepts or that ensures that your facility is contracted with for this question. The same applies for, I'm going to scroll, there's a lot of insurance options. The Medicaid payment type. If you select Medicaid, we will, as relevant in your state, ask which managed care organizations your facility accepts as well. So that's another question that we have available here. Again, you'll make some selections from the checklist, and then you're able to go on to the next question. Another question we ask is how your facility provides patients with estimates of out-of-pocket costs for treatment. You can make any selections here that make sense. One thing I'll note is you'll see that the survey questions provide directional information. So you can read a question and it will tell you how to answer. Please check all that apply. That means that you can make multiple selections. When you don't see this option to do a checkboxes and it doesn't say please check all that apply, you'll notice it's a single select option. So you will have one field selected where you'll be able to answer yes, no, or you'll only be able to make one single selection rather than being able to check multiple options. And that applies to this question about whether or not your facility accepts a sliding fee scale. We ask also about what type of medical setting describes your facility. Each of these are defined for you so that as you're thinking through which setting describes your facility, you can make an appropriate selection. I'm sure that you've been seeing as we go through that also these little red asterisks are appearing next to the required questions. So those indicate again that you have to answer that question before proceeding to the next page. I'll show you very quickly what happens. We won't answer the National Provider Identifier question. We will instead skip it. We'll make selections for the other ones. What's substances this facility treats. Again, these are facility details that we're having you complete. And then a couple of questions at the bottom. You'll notice that since we selected outpatient care, outpatient is appearing here. If you were to make a selection for another level of care, be it residential or inpatient, you would have another row for residential and or for inpatient. So we collect information on what specific populations you serve by outpatient, residential, or inpatient. And that's because we recognize that you might have a residential program specific to a group, be it adults specifically, be it women specifically, and we want to make sure that that information is captured in the level of detail needed. You can go through. Again, you're making these selections as you complete the survey. These questions are required. And then we'll try and go next. You'll see that we get an error message, and this can be a little intimidating at first, but really all you need to do is it gives you a pointer, you click go to the first error message, and you'll see it takes us right to the MPI question. You didn't answer that, it's required, we see the red asterisk. It notes that in the top in this error language. And so all we need to do is give a response. We're putting in some test or fake responses. And then we should be able to proceed to the next page. So you'll notice that a lot of those facility detail questions, you may need to engage with other people on your site about. You may need to engage with billing about the type of insurers that are contracted with, about your MPI. You may want to engage with some of your marketing teams or otherwise. Maybe you don't have a marketing team, but when you're thinking about things like mission statement and the language you want to include there. So always with a reference copy, we encourage you to think through, which staff would be most helpful for you to have contact with or to talk through for some of these questions, because they can be specific to things like your billing practices. They can be specific to things like your staffing. And it's good to know this ahead of time so that you can engage the right people when you're answering these questions. Section C looks at fast access to treatment. It asks about how to help patients if certain services aren't available, like walk-in, same-day access, and also asks about telehealth and your facility hours of operation. So you'll notice the first question asks how quickly patients can receive care. We have this question for outpatient care as well as inpatient or residential. I'm only seeing outpatient here because I only indicated that I'm an outpatient facility, but if I were to make indications that I have residential programs or inpatient programs at this site, those questions would also appear as well, because we have display logic throughout the facility where certain earlier questions impact the questions that you see later in the survey. So you're never having to answer anything that doesn't apply to your facility. We'll answer yes, we have same-day access or walk-in appointments for patients. We'll go through, we ask what does your facility do if a patient requires withdrawal management services? This is again a check question. And then we have a telehealth question as well. And this asks what types of telehealth services are available at your facility. Like I said, certain responses lead to other questions. So you'll notice when I make certain selections for the telehealth question, additional questions appear just to further detail your responses so that we have a sense of what telehealth services are available at your facility. You simply need to answer those questions and again, click next. So you're able to proceed through the survey. We also ask in this section about what hours your facility is open. We have 3 options. You can click open for 24 hours. You can select closed, or you can click open for a set period of time, and you can make 1 selection per row as indicated in the instructions. So if your facility is open 24 hours, you'll want to make the selection in this row. If it's closed, you want to indicate that perhaps we're closed on the weekend. You'll want to indicate that in the appropriate rows. We have rows for each day of the week. And then if it's open for a set period of time, say a 9 to 5 slot, you're open Wednesday, Thursday, and Friday for very specific periods of time. You'll make those selections in that 3rd column. When you click next, we'll just ask that you provide the times in which your facility is open, and you'll want to provide in this date format. We provide it up here in the instructions. So you'll be able to know exactly how you should format these times so that we can have your data submitted. And we'll say we're open 9 to 5 as stated on the previous page.
And Shannon, as you're filling that out, just a quick question. What happens if when we're submitting the survey, we don't submit in that format? Like, is there any sort of check or what will happen to our survey?
So if someone doesn't, so say you don't hit and submit in this appropriate format, you'll get an error message. It will point to exactly which row needs to be corrected. And so long as you add in the time in the appropriate format, it will allow you to proceed through the survey. So instructions are always there. There's always language that pops up as you're completing the survey. We want to help you as much as possible. So if you ever receive an error message, it will give you some indication of why the error message is there. If it's not clear enough, contact the help desk. We're more than happy to walk through it with you and to figure out how to help you through the process. The second section is specific to personalized evaluation and treatment plan. This focuses on asking questions about how you assess patients at intake evaluation and also throughout their treatment journey. The first question asks about which standardized assessments you use specifically at intake. You can make as many selections as makes sense. And you'll note that if you select certain options, if your assessment tool is required by your state or county, we'll have you indicate which specific assessments you're using in that other text field. As you go through, we also look at how this facility collects patient data over time. Say we'll select at specific intervals in alignment with operational protocols, but you can make additional selections as they make sense. And then it asks also for these specific outcomes or symptoms, at what time point during the patient's treatment journey are these data collected? So when does your facility collect information on acute intoxication, withdrawal potential, and all of these other outcomes and symptoms listed in this far left column? You can make as many selections as is appropriate over here. You'll notice here I might say one is evaluated at intake, another is evaluated both over a course of treatment on set intervals and then as needed based on clinical judgment. Others might be just specific to clinical judgment. One might just be evaluated at discharge. And then if you select this option, we do not assess this outcome to inform changes to your treatment plan. Or if you select any other response option that says, we don't do this, what you'll notice the box is selected, but you can't make any other selections here. That's to prevent you from having an inconsistent response. It's logic built into the survey. If you make this selection an error or you want to update the information, all you need to do is simply click this box, and then you can go and make some additional selections up here. So this is a very exclusive select, but you can always deselect it and modify your response as needed. We then ask what instruments your facility uses to collect patient data over time, not just at intake. We'll ask you to make some selections here. Again, you can check all that apply. And then we also ask how this facility assesses social determinants of health. So what specific, at what specific time points does this facility assess or monitor patient social determinants of health? And if you do assess patient social determinants of health, what you'll see is we ask for their specific instruments. Obviously, this is a very instrument measurement heavy section, so you'll want to think through which staff have the most familiarity with the types of assessments that are completed on patients. You want to think which clinical staff are most helpful in answering these questions, and think about when you'd want to send these questions to them or have them included in the survey completion process so you can ensure you have answers to all these questions. But this section D, very measurement focused, so you'll want to have that in mind as you're completing the survey. Section E is specific to the medications that are available at this facility. The first question asks to what extent are medications available at this facility. You can indicate that your facility provides on-site access or facilitates off-site access. You may treat patients who are prescribed medications but not offer access to medications. In that case, you'll want to make that second selection. Or you may not offer medications or treat patients who are on medications for addiction treatment. So that'll be that third option. If you select this first option, you'll see that we ask you to specifically indicate which medications you offer access to, and you're able to indicate whether you provide on-site access, facilitate off-site access through these two options, or whether you don't provide access to this medication at all. So if you provide on-site access for methadone, you'll be able to make that selection. If you provide off-site access for the buprenorphine options, you can make that selection. If you feel like more than one applies, you can make multiple selections here. And then again, if you don't offer access to naltrexone on-site, you'll want to make that and select that far right column, neither provides on-site nor facilitates access off-site. You'll note again that if you make this selection, you cannot select any other options in the row because you're saying you neither provide on-site nor provide off-site access. But you can always deselect this as needed. Same questions are asked about medications for alcohol use disorder, so you'll go through and make those selections as well. Again, as you're going through this, you'll want to have in mind those staff that can best assist you in answering these questions. Probably it's your clinical staff, but you want to think through how best you can include your colleagues in this process as you're completing the survey. If you answer that you offer access to buprenorphine and or methadone, you'll also be asked how your facility uses buprenorphine and methadone, whether it's for maintenance services with medically supervised withdrawal after a predetermined time, or detoxification services. So you'll want to go through, you can check all that apply. We'll say that all three to show how you can check all the options. But you want to make sure that if you select buprenorphine or if you select methadone and you offer these medications, either through offsite access or onsite access, that you're answering this question as well. And then finally, in the medication section, we ask about if your facility provides access to naloxone. You can indicate potentially you dispense naloxone, and you educate patients on how to use it. There are other response options here. And then you'll see, for validation purposes, if you indicate that you dispense naloxone, we'll ask you to tell us how the number of kits you distributed over the past 12 months, over that very specific time period, and we'll say a certain number. Section F is focused on behavioral therapies available at your facility. You'll want to read through and make selections for the behavioral therapies that your facility offers on site. You'll notice that they're described here in this tooltip. You can see the dots underneath them, so you can always scroll through and get definitions for these behavioral therapies. And one thing I also want to show is, again, you can deselect response options as it makes sense. But if you select this none of the above, you won't be able to make any selections here. So when you have these checkbox questions, you'll notice that they gray out. If you see this, it's an indication that you selected none of the above. If it no longer applies and you want to make selections, you deselect it. And you can always just go back and change your response at any time. But if you are selected, it will be that lighter gray color. So that's what that means. We also ask if one-on-one counseling or therapy is offered to patients, and that's a yes or no question, so you'll make a single select there. We have a question specific to laboratory tests and toxicology protocols. Does your facility conduct lab tests? You'll notice that if you say yes, there are some follow-up questions that we ask, whether it's required for treatment, when over the course of treatment lab tests occur. Make the selections that make the most sense for your facility. And then we ask for the specific lab tests listed below. When do you use these lab tests? And you'll see there are options available at the top of the table. So for each of the lab tests listed here, you'll want to indicate when or for what use these lab tests are conducted. You can select multiple options in these tables, similar to previous questions structured in this way. And you'll note that if you select for other purposes, we'll have you describe it in this box below, and you'd simply type it out. And if you make this, we do not use this test, then it will prevent you from selecting other options. If you select that you do use an other test that isn't listed here, we'll also have you identify that in the text box below. As part of our validation process, and we don't share this publicly, we also ask you to provide us with your facility's internal protocols for conducting lab tests. You can either provide a summary here, or if you have an internal protocol available for upload, you can click this browse link and upload your protocol. I'll note that this is for validation purposes only. We don't share it outside of Shatterproof, but we use it to validate the information you provide us on lab tests in this section and toxicology protocols. So we're coming to the end. We're getting through each section. We have another section that's focused on coordinated care for mental health and physical health. I'll note that this section asks a lot about staffing, so you'll want to have your staffing expert online for this piece. You'll want to make sure that they are available so that they can help you answer these questions. Or maybe you're the staffing expert, in which case it's all in your brain. We ask you to indicate to what extent primary health care and mental health services are integrated at your facility. It may be that they're on-site. Perhaps you have on-site primary care. Maybe it's off-site, in which case you'd make the selection with the various options available to you, or maybe it's none of these, in which case you'd want to make that none of these selection. We'll indicate on-site and off-site. We ask which screening tests are conducted at this facility, so you can select the appropriate testing and screening that's available. We have a few options listed here and room for other, and we recently added COVID-19. We ask, do you prescribe medications to treat co-occurring mental health conditions? That's something that's very important to patients that we've learned through our ATLAS testing overall. So you can indicate yes or no. And then we have you select the staffing types that are available at your facility. What types of staff are at this facility? You can make the appropriate selections here. And then you'll click next. And after you make these selections, you'll note that we have some follow-up questions as well based upon which staff types you selected. So, is a physician available for consultation? You can indicate yes or no. The primary areas of focus for your staff people, so are they involved in primary health care, mental health care, or substance use disorder treatment? You can make as many selections as it makes sense to give some specificity to what types of care staff are particularly involved in. And then we ask for the number of employees, and we break this down by full-time staff and part-time staff. So you can, if you don't have a full-time staff person, you can always put 0. And then if you have a part-time staff person, you can put 1. But we ask that you put numbers in for each of these so that we have a count of the types of staff available at your facility. And again, you really want to engage with your staffing person when answering this question so that the table can be filled. And if you have any questions about this, please reach out to us. We're happy to help with it. But this is a count of staff. It's not FTEs. So that is how you enter staffing. We have the section that follows, additional services to support recovery. We ask that you indicate for the services listed in this left column, whether it's offered by your facility on-site, offered through a direct referral, or not offered at all. So you can go through and make those selections for these specific services. You'll note you can only select one option in this table. And then we also ask at the bottom if your facility partners with a social services referral organization. We define that here. If not, totally fine. Just make that no selection. If yes, you'll want to select yes there. Section J is very specific to licensing, certification, and accreditation. You'll want to indicate, and most of you will indicate, that you have some licensure or certification for substance use disorder treatment. You can also indicate if you have it for mental health treatment or other types of treatment. And we'll ask that you upload a copy of your, we'll ask that you upload a copy of your licensing or certification documentation, whether it's indicating you're in good standing or it's the actual license or certification in this section. I'll upload a random file there just to show you that that's how you use that upload feature. And then we also ask you to indicate which accreditations your facility holds. Totally fine if it's not accredited. You can always make this facility is not accredited selection. We ask if licensure, certification, or accreditation has been revoked in the past 5 years. We'll hit no. And then we ask if this facility has obtained the American Society of Addiction Medicine level of certification. If it doesn't apply to you, you can always make that this facility doesn't have any of the above ASAM level of care certification, and you'll see the gray out feature works. Last section about your facility specifically. So we ask about some additional services or information about your facility in this section. Think accessibility, think specific types of programming. You've already provided a lot of your details, so this is just getting at some of the little bit more granular programmatic stuff that's available on site. We'll ask whether your facility offers any services to LGBTQ+ identifying patients specifically. Make all the appropriate selections for your site. We ask what services or features your facility has. This is asking about what types of policies you have in place, what types of training for staff, protocols for staff that are in support of patients. You can make some selections here as well. We asked if your facility has a formalized treatment program. So does it have a program beyond this, like the general services that it offers? So say it's a residential program for adults. Does it have a specific program that's available on site? So do you have a specific program outside of those general treatment services for pregnant or postpartum women? Great, then you would make that selection down here. You don't want to indicate any type of population you serve here. You want to indicate if you have a very specific formalized program for a very specific group of people. So this question can be a bit confusing. We wanted to make sure that was especially clear. We ask that you indicate if your facility only serves certain populations. You make that selection here. We ask about EHR. If you do have an EHR, you'll be asked to indicate a number of details about it. These are very straightforward questions. What type of data does it record? Is it an integrated EHR? Things like that. If you say no, you'll see the display logic works such that you don't have to answer those questions that don't apply to you. And then we ask about a couple of things related to just this facility and site in general. What is the tobacco policy? Is it wheelchair accessible? Do you have adaptive technology for individuals who are blind or visually impaired? And I think these questions are straightforward, but again, if you have some nuance to it, you want to ask us how best you should answer these questions, feel free to reach out to us. We also have a set of questions specific to how to patient care. We ask if your facility allows loved ones to be included in the treatment process. Is our patient satisfaction surveys in multiple languages, just to get at some of these elements of patient-centered care. You can go through and read them. And then the final question that we ask about is what languages are offered at this facility. We'll indicate that we have languages, we offer Chinese, any Chinese dialect, and Spanish. When you go to the next page, you'll see that if you do make certain selections, we dig into a little bit more what specific Chinese dialects. And then you'll note that any selection you make impacts the last question, which is to what extent are other language services available on site? Maybe you have clinical staff fluency, maybe it's interpreting services and educational content, but you'll want to make those selections in this question. And you never have to answer for selections you didn't make in a previous question. We've really endeavored to streamline this as much as possible. So you see, you don't have to answer for all of the languages, just those that apply to the site. And then we have a question about how patients learn about this facility. And you can make those selections here, check all that apply, and then hit the next button. We have some research questions towards the end. Read through. You're not required to answer these questions, but if you're able to, like how many patients are provided outpatient care, feel free to enter these. We use these for research purposes only, as mentioned in this section. And then here you'll see that there's the option to PDF your survey. So if you wanted to download a version of the survey, you'd simply select this link and you'd have a full version of all of your responses available for you to archive as needed. The final and one of the more important parts of the section of the survey is that we ask you to attest. So we want you to select and indicate that your senior leadership person, be it a CEO, a COO, whoever is the appropriate senior leadership person at your facility, has read these responses. You can use the PDF for that, send them the PDF, they can take a look at your responses, and that senior leadership person attests to the accuracy of your survey responses. We require this as part of our validation protocol. This person can be sent the same survey link that you received. They'll be able to go to this section, take a look at the PDF, go to this section. Especially if you've saved your survey here, they'll just go directly to this page after they review the PDF. They click that they attest the survey data, and then they answer their information. I'll answer for myself. I enter my full name, enter my title, and this is home stretch here. Once you're at attestation, you're so close. Your senior leadership has resigned as attested. You're entering all this information, and then quite simply, you click the next button. Oh, or you get an error message. I didn't enter the email address correctly. This is a great opportunity, learning opportunity for all of us. I typed it too quickly. The survey saved me. I typed the wrong email address and it was on my side. I corrected the email address. I was so excited. I thought it was at the point of submission. I hit the next button because I have fixed it. It may take a second here. It may take a second here because you're submitting, so it may take a second to load. Do not leave the page. You don't want to do it again. Although it will save, so you just probably go back to the attestation page, but wait a second so it can get to this thank you page, and then you're done. Our expectation is that you receive a thank you email when you submit the survey to the primary contact or whoever submitted the survey. If you don't receive that thank you email, please reach out to us, and we're happy to confirm that your survey has been logged and is archived in our database. Always reach out if you have a question about that, but you should get the thank you email. Again, if you have any questions, we have a help desk, we have office hours, we're here for you. We want to help you complete this. You have the reference copy, so you can start to think through which staff are most appropriate to include when answering these questions. And feel free to reach out through this process. But we wanted to give you an overview of the survey, and we appreciate your time. Thank you.